Does your dog have bad ears? In this webinar, I'm going to show you how to clean them, and that way you can help treat them and get them resolved. I'm Dr. Jeff Grognet from the ACE Academy for Canine Educators. In this webinar, I'm going to show you how to clean ears and then how to treat them. Now, the first thing you need to know is, where is the problem? Is it on the ear flap? Is it on the ear canal? Or in the ear canal? Or is it both the flap and the ear canal? This makes a big difference in how you're going to clean it and treat it. If it was just on the ear flap itself, you would use gauze, get it wet, wipe it down on the ear flap, dry it off, and then you can apply ointment directly to the ear flap. This is very common with allergies. The other thing we can have is a problem down the hole in the ear canal. And in these cases, what we need to do is to clean out the canal, and then once that's cleaned out, and that is the debris removed and it's dried, then you can put ointment in. There's not a lot of point in putting ointment in if it isn't clean, because all you're going to be doing is adding it to the muck and the wax that's down there, which dilutes the ointment, but also in some cases the ointment doesn't even get through to the skin inside the ear. So we need to figure out how to do this. And this is what I'm going to show you in this video. The other thing that's very important to know is, what are we treating? And there's a few different things that we can look at. One is inflammation. Now this could be because of allergies or because of infections. The ear canals are red and sometimes they're very painful. All you have to do is go and squeeze it sometimes just below the ear flap, right on the canal, and the dogs will cry. That means the ear is painful. So that's inflamed. You're going to need a steroid, like a cortisone or something, to take that inflammation down. The other two things we can get in the ear itself are yeast infections and bacterial infections. Now in the case of yeast infections, those ones you can smell. And just think of bread. That's what it smells like. It's sort of a sweet odor, and it may remind you of freshly baked bread. But that's what it smells like. In the case of a bacterial infection, it smells really bad, and it's just like something rotten. And the way to do this is to get your nose and lift up the flap and put your nose right there, and you'll be able to smell it, and it'll tell you what type of problem you're dealing with. Of course, your veterinarian is your best way to figure out what's going on. But anyway, let's go move ahead into this series here and see what's going on in terms of cleaning the ears and then treating it.
With this ear, you can see that we've got just a big mat of hair and wax, and that is totally plugging the canal, and both down the canal and at the top of the canal where the ear flap is. I'm using a pair of hemostats. These are a small instrument that are used to clamp blood vessels. I find them quite useful for pulling out hair. So in this case, this little guy, we have to clean this out first before we can start cleaning the ear. I quite often get asked whether or not plucking the ears is painful. Most dogs really don't seem to notice it very much, and in this particular case you'll notice that we did have a muzzle on this dog, and the reason for that is because this little guy unfortunately would try to bite you no matter what you did. But anyway, taking the hair out normally isn't a very sore process at all. And so in this case we were able to take it all out, and as you can see I'm just using gauze soaked with cleanser to clean off the ear flap, and now I've just put the cleanser into the ear canal itself, and there I am squeezing it just to milk it up and down. You're going to see this in another dog later. It'll be a lot more evident what I'm doing. But anyway, what this does is it loosens the dirt down in the ear canal. Then I can wipe it out again, and then I'll probably end up cleaning that again probably several times until the gauze comes out clean. Another option, of course, is to flush this, as in put a catheter down and flush the material out. But this was just on a quick office call. We just wanted to clean out what we could and then start treatment. Now the treatment consists of putting the ointment on the ear flap. You can see here the ear was quite red where it was inflamed, and so we definitely put the ointment onto that area and rub it in with your finger. And here you can see I'm putting several drops down the ear canal. I like to keep the tip of the ointment well above so I can see how many drops are going in, and then just massage the ear below, and that way we've got it covered. Now here's a wonderful old fellow. Now if you look at this ear, his problem is really allergies, which means the problem is on the ear flap as opposed to being down the ear canal itself. So we get the cleanser, put it on the gauze, and then I rub and clean the ear flap. Now as you can see, I'm not really being gentle here. I really must scrub this to get all that crud and scale off there. And most dogs just really like having this done anyway. And this guy sure does. So we just keep rubbing away, and what you'll see is I'm just going to keep pulling that stuff out of the hair. Sometimes it is so bad that we have to shave the hair off the edge of the ear flap to be able to get it all cleaned up. This guy, his hair was thin enough and it didn't extend that far into it, so I didn't have to. But here we are. We've cleaned that ear flap off here, and also do it again. Put some more cleanser on the gauze and just rub away and just make sure that we can really get that thing clean. You can probably see that we're removing that scale. We're getting down to skin now. If we leave that scale on and just put ointment on there, all you're doing is you're treating scale. You're not treating the skin underneath, and so that's not going to help. Now at this point I fill the ear canal with the cleanser. I just dribble it in, and there I am milking it up and down. And you'll see it changes from clear to kind of a milky, cruddy discharge. And then I use the gauze again to just clean that out. And I just put the finger down as far as it's comfortable, and I just don't want to hurt this little guy. I'm going to clean it again, so fill it up, milk it. And this time you notice the liquid coming out of the ear canal is a lot cleaner. There we are. So definitely not much of a problem down the ear canal in this one. If there was more debris down there and such, I would have cleaned it several more times just to try and get that stuff out of there. And then what I sometimes do is just push the gauze in the top of the ear canal and then massage the bottom to squeeze the liquid up, and that way I can pull it out. I generally don't like to put Q-tips down these ears because I don't want to push stuff down. What I'm doing here is I wanted to show you where the bottom of the ear canal is. So the ear canal goes vertically down, and then it turns into the horizontal ear at the very bottom, and that leads us to the eardrum. As long as you stay in the vertical, you're not going to cause any trouble to the eardrum. That's what the demonstration was for. And here we are. I've put some ointment on the ear flap. I've rubbed it in, and that way we can start to get that inflammation down on the flap, and then a couple of drops down the hole. And by keeping the ear tip up, I can count how many drops go in, and I don't contaminate the dropper.
I hope you enjoyed this webinar on cleaning and treating ears. I'm Dr. Jeff Grognet from the ACE Academy for Canine Educators. We have a webinar coming out each week from the Academy, and you can sign up by going to www.dogtraining.academy. I hope to see you there.